So, the other thing that we also understand that it is not easy being a vet because there is also an emotional toll
Yes.
that it takes on you. So, how do you deal with that?
I can't say that it doesn't affect you, right? But somehow you still have to put that little bit of a wall, and otherwise you can't function.
So, have the roles and expectations of vets also evolved?
I think basically it's the same, right? We are still like your doctors, right? If they're sick, they come to you, and then we try to get them better again. Okay, the basic role is still the same. Yeah.
So, the other thing that we also understand that it is not easy being a vet because there is also an emotional toll
Yes.
that it takes on you. So, how do you deal with that?
It's not the easiest thing. Maybe being a guy is a little bit easier. I do see it affecting the ladies a little bit more. But I think from the early days, there was kind of like, personally, there was kind of you had to you kind of detach yourself a little bit from it. Okay. It's sad when you actually take care of a puppy all the way till they're 15, 16, 17, 18 and come down with all the chronic diseases. And the day comes that you may have to put them down. Okay. I can't say that it doesn't affect you, right? But somehow you still have to put that little bit of a wall, and otherwise you can't function.
Yeah.
In a very busy practice like our practice, sometimes you have to go and do a euthanasia. But right after that, you've known this dog for 15 years and you've been treating it and you know the owners really well. And you kind of want to grieve with them, but you have your next consultation waiting in the next room. So you have to like put on the straight face and go deal with that one. Okay. Yeah. It's not easy, but we just try and cope.
So, what keeps you going after all these years? I mean, hearing you say this it's really not hard. And for us, we can only imagine how hard it is. And like you mentioned, the reason why you became a vet is, your passion for pets, your love for pets.
Yeah.
So, yeah, what keeps you going after all these years?
Well, I guess it's still something that I enjoy doing. Okay. I guess there's a lot of upsides and there's a lot of downsides, but one of the upsides is that when you actually manage to get an animal healthy again, everybody's happy, the owners are very grateful, and you feel good, right? I also enjoy seeing and meeting all the different dogs and cats and birds and hamsters and rabbits. Okay, so I don't find them boring. Okay, it gets routine after a while sometimes, but they're all different. Okay, owners are also different. Okay, sometimes you get along with certain owners, other owners, no, you just can't stand them, right? But I guess there is no routine in our job. Every day is a little bit different. The animals are different. We are looking at different species. Especially for myself, I'm looking at birds and even tortoises and stuff like that. So the variety is there. One of the things I could never stand is, I could never imagine myself sitting behind a desk doing office job, right? So it was actually a conscious decision to try to pursue vet medicine.
Are you able to share with us like a particular story or a case that you had that kind of reminded you why you love this profession so much?
No, I can't.
Too many stories.
Sometimes it's just too many. And it's
Every
difficult.
story is
Yeah, it's difficult to actually pull out particular ones,
Yeah.
right?
So we also talk a bit about like work-life balance. Firstly, is there work-life balance being a vet, and has it changed over the years?
It has changed. Okay. In the early days, I guess there was no work-life balance. It was very different. When we had less clinics, it's not unusual for us to be working 12-hour days in the clinic.
Wow.
I guess one of the busiest day I've had in our clinic, between two vets, we saw like maybe 60 or 70 cases a day.
Wow.
Right? So it's like go, 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 go. Then after that, you're tired. Right? And we used to work 6 days a week, that kind of thing, open late. Oh yeah, we didn't see our kids very much, that kind of stuff. Right? We did our own emergencies. So we get calls in the middle of the night, that kind of thing. So nowadays it's a little bit different. We have quite a few emergency clinics that are open 24 hours. So it took us quite a while, but we've also relegated our after-hours emergencies to the emergency clinics. Okay? Give our vets a little bit of break in the evenings.
Right. So, what are your thoughts on the increasing role of technology or artificial intelligence in veterinary medicine?
It's very interesting. Of course, technology, there's the good and the bad. The good is that with the advances in instruments and diagnostics, you can actually do a lot more. The bad is that it costs a lot more. Okay. So there's a lot of stuff that I wish I could do, but for example, I just don't have a CT. So I can't run certain simulations or imaging to try to figure out how to fix this complex fracture. Right? No, fractures are easy, but complex deformities, stuff like that. Okay. AI is going to be interesting. I haven't really seen it creeping into the professional space yet, but I think it's starting. So it's going to help all of us, the vets, diagnose our pets better. Okay? It makes it more demanding, but if you keep up with that technology and you follow the flow, I think you'll be okay. It'll probably improve your level of care.
Do you think this would contribute to increased cost as well, or actually be able to decrease?
Like everything initially is going to increase.
Yeah.
Okay. Just going back to my X-ray example, why we never had many X-ray machines in the old days, it was not cheap, even if you get them secondhand. Right? But now the cost has come down, so it's expected every clinic, every decent-sized clinic should have one, right? All your blood machines, right? They used to cost so much, and now they are a lot cheaper. Okay, so as with anything, even your own laptop or computer, your phone, your latest model costs you 1,008, top of the line. Wait a year, the price is down. Right? So initially, it's going to cost a lot, and not everybody will be using it. But as soon as it gets mainstream, then the cost will come down.
So just now we also talked a bit about pets now being like a child substitute, now being the kids. So how has this change also affected how vets approach pet care as well? Has it made a difference?
Yeah, I guess to me it has. You have to be more aware of what the owners would like to do, right? Personally, the way I do things is that you give the owners the option, right? You in the old days, just like in doctors, right? They always say in the old days what the doctor says you do, right? It was kind of like that in the old days, where, of course, the owners didn't know very much, right? So they would defer to us, and we say, okay, we do it like this. And sometimes you would second guess, right? You say, okay, we can do this, but I think it's going to cost you too much money, right? So we'll do this other way, which may not be the best, right? But it'll save you money, and you make that decision for them. But I've also come to realize and learn that you can't do that. You have to give the decision to the owners. You give them the option. You give them the cost. Then they'll have to decide. Okay, and it surprises me sometimes that they will put all their resources into a certain treatment, and sometimes even when you personally know that it's not worth it. It's maybe a terminal disease. You're not going to get better, but they still want to treat it. And you have to respect that, right? Because it's not just getting better or not getting better. You're not just treating or trying to cure that dog. You're also treating the owner.
Yeah.
Right? Emotionally, there's this connection. And if you just say cut, okay, they're going to get affected.
Yeah.
Right?
Yeah. I think it's a very interesting perspective just now when you mentioned that you're not just treating the pet, you're treating the owner.
Yeah.
That really hit me because with my dog, he has conditions where he's hospitalized pretty often. So whenever I have the option to do certain tests, do certain treatments for him, I will always take it up.
Yep.
But a lot of times with giving him the additional treatment also means he's going through a lot more.
Yes, correct.
And sometimes I question myself, am I doing it for him
Yes.
or
Me.
for myself?
Yes.
So that really hit me. Treating the owner as well.
Yeah. So that's a interesting thing as well, because this is we just had our 35th anniversary reunion for my vet class, and they actually came to Singapore and we traveled a little bit, and we get to talking, and it's one of those very interesting things that a lot of us went into vet medicine because we love animals and we want to deal with the animals. We don't like people. We thought we wouldn't have to deal with people. Then now you're saying like, oh, actually, we deal with people a lot more than we thought we would. So we didn't get away from dealing with people.
So, what are the biggest challenges you see facing for the future of veterinary medicine?
I think personally, it's the amount of information and stuff that we can do nowadays. Okay? A lot of treatments. Of course, we know a lot more. So there's a lot more information. You have to keep up with everything. You have to know about the new treatments. Well, one, because the owners know about the new treatments, right? When their dog gets sick with a certain symptom, they're already Googling, right? And they know, roughly, if they are correct, they know what kind of treatments can be done. Okay. And sometimes it's so new that we may not have heard very much about it. Right? So it's trying to keep up with all that information flow, all the new discoveries that are coming, the new drugs, and use it, utilize all that information correctly. Okay? So the owners are going to know a lot more than in the past. And so you must be able to keep on top of it and I guess the worst thing is that the owner knows something that you don't know, right? Nowadays, sometimes I will get owners asking, can we do this? And if I haven't heard about it, it's not good, right? So you have to keep on top of all the information. Then at least you can say, yeah, we could do this. We can do this dialysis, for example, but nobody in Singapore has the machine, right? And even in North America, it's only in very high-end specialist places, right? So yes, we can do it, but practically no, right? So yeah, keeping on top of all that information explosion is probably one of the bigger challenges.
Right.
Yeah.
So what advice would you give to aspiring veterinarians?
I guess the thing that I would say is, if you're thinking of it as a profession, it's not all play with puppies, okay? There's a lot more to veterinary medicine than playing with the animals, right? A lot of the younger kids, yes, because they think of this profession because they've had pets, they grow up with animals and they love animals, they love dogs and cats, okay? But reality is, if you go through vet school, you're not just learning about dogs and cats. You have to deal with your horses, cows, pigs, chickens. You have to know everything. So going through studying all that in the first place, then you have to go through the not so nice aspects about it, where, slaughterhouse, public health type stuff. Okay. Then when you graduate and you start working, it's not just playing with the animals. You're dealing, like I said, I thought I didn't have to deal with people, but now I deal with people every day. So it's not what you think, basically. So you only go into it if you have that real love for it and you think you can do it. The money is not up there like most people think. Okay, you'll survive. You're not going to be, trying to live month to month, but you're not going to be very rich. Okay, if you want the money, become a banker or become a doctor, and then you can have the money to play with pets. Okay.
Yeah. So what advancement do you think will have the most significant impact in pets' lives?
I haven't thought about it that far. Actually, I don't know. Frankly, no idea. For dogs and cats, I think it's already pretty standard. I mean, nutritionally, we know what's happening. We know what's good, what's not good. But if I'm thinking along the lines of like birds or reptiles or all the other exotic species, yes, then there's still a lot more advances there in terms of nutrition. Husbandry, yeah, most of us know about it. But nutrition is probably one of the main issues, even for dogs and cats. Like when we started, nutrition was, you kind of know about it, but it's still not as refined as it is now. So, and nutrition is the basis for everything, right? If you don't have good nutrition, you don't have good health. Okay.
Right. So, if you could now give pet owners one advice that would make their pets live a better life, so what would that be?
Don't let them get fat. Okay. Yeah. It's I deal a lot with hip problems and orthopedic conditions, and this is what you see. It's the same in people, right? If you're heavy, you put more weight onto your joints and you're going to have more problems. And when you get older, your muscles are weaker. And if you're still fat, then you have a lot of problems with mobility. And mobility is like, without mobility for these pets, actually, your quality of life drops. Okay. But we also know that obesity is the root cause of a lot of other diseases, right? Diabetes, for example. If you have a cat, if he's overweight, he probably has about 4 times the chance of getting diabetes as a normal weight cat.
Wow.
Yeah. So same with people, right? I mean, look at slowly in Singapore we're getting there, but look at North America, maybe 2/3 of the population is obese, and they now know that it's a problem, it's a disease, and they're all trying, with all the new GLP drugs, they're all trying to lose all that weight. Okay, Singaporeans like their dogs fat. Okay, I always tell my orthopedic clients, okay, you got to slim down. And what you want is for your friends to say, hey, your dog is thin. You're not feeding him. Then probably that's the correct weight he should be at. Because Singaporeans are used to seeing fat dogs. So if they say it's thin, it's probably correct.
Yeah, if we go to clinics, we actually sometimes see the body scoring chart,
Yes,
right? So you should actually be able to see the
Yes, you want the
shape.
waist, you want the tummy up. So it's not easy because dogs have good life nowadays. And they get all the snacks and treats, and then they don't run around, they just hang around at home.
Mostly it's indoor.
Yeah, indoors. Yeah. So I think, if there was one advice, that's what I would say. Don't let them get overweight. Okay. It's really easy for them to get overweight. And it's just like in people, it's very hard to lose that weight after that. Okay.
And what are your hopes for the future of veterinary healthcare?
Well, it's getting better and better by the day. We have a lot of things a lot of drugs and procedures that can help us improve the care, the treatment of diseases or conditions. I guess eventually it's going to be the same. Basically, what you can do in humans, you can pretty much do in your dog or cat. It's a matter of cost, right? And cost and expertise. Right? That's already getting a lot better because there's a lot of continuing education in the region, and a lot of our younger vets are actually keeping on top of it. We never had all these specialists in Singapore, and now we have at least 10 or more. So that improves the level of care that can be offered to their pets. So hopefully we'll get to the North American and European standard, but hopefully without that cost, because that's also a big factor, I think.
Yeah. Okay. Thank you so much for your time, Dr. Hsu. We
You're
really
welcome.
appreciate it. Yeah, you really gave us very good insights. Yeah, and really, a lot of things that he said that we really should think about as pet owners as well.
Too many things.
Too many things.
Yeah, so thank you, everyone. We've come to the end of the episode, and we'll see you in the next one. So if you have any comments, any questions, feel free to put them in the comment section down below, and we'll see you again. Bye.
Bye.